Hi, this is Dr. Jawad from Total Health and Wellness Center. Today I'm going to talk about the benefits of vitamin D, in particular the supplement vitamin D3. Now I'm going to talk about four main concepts. One, what is it? Two, what it does. Three, why is it important to us? And four, the most important question that I get from my patients is dosage. How much should I take on a daily basis? When should I take it? And how much? Now, vitamin D3 is very important supplements. If you saw one of my previous videos, I included it in my top 5 supplements that we should be taking daily. Because vitamin D3 is very, very important for overall health, and it should be taken on a daily basis. Now, there are many constant factors out there that will make us vitamin D3 deficient. First and foremost, pollution. Secondly, the use of sunscreens. When we use sunscreens, that actually blocks the absorption of vitamin D3 through the sunlight's ultraviolet rays. So that makes us become more vitamin D3 deficient. Thirdly, the use of certain medications. Certain medications will block the absorption of vitamin D3, which will make us vitamin D3 deficient. Fourthly, we're spending more time indoors than outdoors. So when we're spending time indoors, we're not getting the sun's natural rays. So it's going to make us vitamin D3 deficient. That's why it's important to get your blood levels checked and also to supplement your daily diet with a vitamin D3 supplement for better overall health. So what is vitamin D? Vitamin D is a fat-soluble nutrient, which basically means that it absorbs through fatty acids, and if you're going to supplement with vitamin D, you need to take it with some type of fatty food. Actually, I recommend all my patients to take all their vitamins and their minerals with some type of food product, because there are certain vitamins that are fat-soluble vitamins only, and they absorb through a fatty food. Also, you want to take with food for better absorption, quicker absorption, and better utilization. Now, vitamin D is one of 24 micronutrients that our body needs on a daily basis for optimal health. Now, there are certain foods that contain vitamin D, and like for example, beef, egg yolks, cheese, yogurt. All of those foods do contain vitamin D. Okay, so if you have a deficiency in vitamin D, it can only increase your chances of having a condition called osteoporosis. In kids, it's a condition called rickets. So in adults, it's called osteoporosis. It's still a deficiency in vitamin D. Now, it helps our body absorb calcium. Now, calcium and phosphorus are two minerals that are combined, and they're needed and they're utilized for optimal bone growth and bone health. So again, if you have a vitamin D deficiency, it's just going to increase your chances of having a condition called osteoporosis or brittle bone disease as you get older. Now, one major source of vitamin D is through our sun's natural rays. And this is where just a little bit goes a long way. So I always recommend to my patients, if you could go out the sun anywhere from about 10 to 15 minutes, that's optimal. Because that's going to help your body utilize the ultraviolet rays. And what it does, it helps convert cholesterol to vitamin D in our system. So if taking a walk in the afternoon for about 10 to 15 minutes without sunscreen, that helps convert the cholesterol that we naturally make to vitamin D so our body could utilize that. Now there are many benefits of vitamin D. First and foremost, it boosts your immune system. Secondly, it increases your cognitive function, which basically that means it's your brain function. 3, it improves overall bone health. Now remember, calcium is needed as phosphorus, and also too, vitamin D is needed too for overall bone health and bone development. If you have a deficiency in either one of those, it only increases your chances of osteoporosis. 4th, it also improves your overall sense of well-being as well as increases your testosterone level. Now, males and females, we do have testosterone as part of our hormones, which not only increases your brain function, but also too increases muscle development. So the more muscle tone you have in your body will increase your chances of losing weight. So having a vitamin D deficiency, this may be one of the reasons why you're not losing weight, because you're not increasing muscle tone. Okay, so the main question I always get is, why should I supplement with vitamin D? My answer is always, unless you spend hours in the sun or live in an area where you have consistent sunlight, there's a good chance that your levels are not within optimal range. In fact, for the majority of patients I treat on a daily basis, they are not at optimal range whatsoever. And it's next to impossible to get your vitamin D levels at optimal range through eating foods on a natural and consistent basis. So supplementation with a vitamin D supplement really changes your overall health, and it changes it almost immediately. Okay, so the benefits of vitamin D. The benefits of vitamin D, there's a lot of them. And what I get back from my patients is one, overall boost in your immune system. So if you have a boost in your immune system, that means less sick days. Also two, they have overall improvement of mood and well-being, which basically means better concentration. So they're able to get more work done on a daily basis and be able to stay focused. Also three, if your levels are low, that means your testosterone levels are low. Now, males and females, we do have testosterone in our system, males more than females, just given. Also too, but testosterone does increases brain acuity, but also too, testosterone is phenomenal for muscle recuperation. So if you're trying to lose weight and you can't, by increasing vitamin D will help with muscle recuperation. So if you have more muscle tone in your body, that just basically means the chances of losing weight are going to be there. So there's a lot of research done for vitamin D, and I always recommend vitamin D as a great supplement to include in your daily program, and two, the research backs it up. So the fourth concept I want to go over is dosage. People always ask me, how much should I take it, when should I take it, and of course, what brand do I recommend? Firstly, I always recommend get your D levels checked, because remember, most people, at least the people that I treat, are hovering around the low end. They think they're at optimal levels and they're really, really shocked to find out that they're really, really low. So I always recommend getting your D levels checked first and foremost, because everybody's different. We all metabolize vitamin D at different rates, and also too, there are certain factors involved that will actually inhibit the absorption of vitamin D into our system. First and foremost, medications. There are certain medications out there that will actually block the absorption of vitamin D into our bloodstream due to the side effect of the medication in of itself. Also, body fat percentage. The higher the body fat that you have on your body, what the adipose tissue does, it actually blocks, it acts as a blockade, so it actually does not absorb the vitamin D into our system, so that's why you're vitamin D deficient and you think you're taking optimal levels in. So the higher body fat percentage you have, it actually is acting as a blockade, so you're not taking enough in, okay? But the baseline I always recommend is taking 5,000 IUs a day, okay? Until you get the levels checked, take 5,000 IUs a day. The conversion is you should take in 1,000 IUs per 25 pounds of body weight. So that means if you're 100 pounds, you want to take in a minimum of 4,000 IUs a day. If you're 200 pounds, you want to take in a minimal of 8,000 IUs a day. Now again, that may seem on the high level, but don't forget there's a couple things involved which will actually inhibit the absorption of vitamin D3, and that's medication and also body fat. So that's two considerations you want to take into effect when you're taking the dosage. Now, people always ask me too, what type of D do I take in? I always recommend vitamin D3. Okay, vitamin D3, it's a hot product on the market. Again, I recommended it as my top 5 supplements if you want to watch a previous video. So it's vitamin D3 is the best kind that you need for overall general health. Now, there's a lot of brands out there. What I always recommend the Now brand. I know Now brand it's a good brand. There are many brands out there, but I always recommend the Now brand. And when should you take it? I always recommend take it in the morning, and again, take it with food because it is a fat-soluble nutrient, okay? A lot of people, sometimes they take it at night. If you take it at night, it may interfere with your sleeping patterns, so that's why I always recommend taking it first thing in the morning. Again, take it with food. Okay, thank you for watching this video. I hope you found this information useful, and if you enjoyed it, please hit the like button, and if you found it useful, please share with a friend. You can see more videos like this at www.totalhealthdebate.com, located in Carroll Stream, Illinois. The phone number is 630-653-2225, and as always, be well.